With cold and flu season just weeks away, it's inevitable your child will likely get sick. In years past, you might have shipped them off to school anyway, but new policies in the age of coronavirus mean students will have to stay home at the first sign of a sniffle, possibly upending the lives of your entire family for days.
This is a time where kids will get sick. So what does that mean for parents who don't have sick days and have benefits and can afford to take this time off?
Anna K. Brown works from home, so if one of her two school-age children wakes up with a sore throat, a runny nose, or a cough, she won't be scrambling for last-minute childcare. But that's not the case for other families in her neighborhood of Jane and Finch, one of Toronto's hardest hit by COVID-19.
They have to come up with realistic expectations for families, and to also keep in mind that not every family and parents have the luxury of being able to just say, my child is sick today, I can take that time off.
Toronto Public Health says screening your child every morning will be key to keeping COVID-19 out of schools.
Active screening is like a fortress that we put around the school, because what we want is for schools to be safer. We don't want COVID to spread in the schools, and we want to be able to keep schools open for the whole school year.
But
if you tick off that your child has even one of those symptoms, your child needs to stay home.
Parents should be looking out for new or worsening symptoms.
We don't want to send kids home with underlying conditions that are always there.
If it's a new symptom, Dr. Anna Banerjee says COVID in kids can be milder than in adults, and that's why health experts are calling for vigilance.
Just a runny nose could be COVID.
Public Health recommends students get tested, though it's not a requirement to return to class under Ontario's school reopening guidelines.
If a parent chooses not to have their child tested, they, though, will be out for 14 days. And so there is an incentive for getting tested, because if you get tested, presumably you can get your child back to school sooner.
But Banerjee says testing can be unreliable in children and could put stress on the system. She suggests keeping sick kids home for a week.
You have to assume that any kid with any new symptom could potentially have COVID. I know it's really difficult for some parents to keep their kids at home, but I think the alternative is really, we're gonna have resurgence, and we're gonna have increased outbreaks.
Advocates like Brown say they understand the need to be precautious, but this will leave many families in an impossible situation.
It's a very sticky situation for parents, and especially working poor parents. If we are going to say if a child has a mild symptom of the flu, to keep them home because we're not sure if it's COVID, then at this point it doesn't make sense to open school then.
Before the pandemic, provincial health officials say there was about 10% student absenteeism in Ontario schools on a regular day for a variety of reasons. But they're not working from any particular assumption about how many students may be missing class this year. For City News, I'm Caryn Ceolin.